Now we're going to move to Helen Doyle, who's the chair of the Ontario Public Health Association's Environmental Health Work Group. And she'll speak to the design and the implementation, among other things, of the Make It Better campaign, which has come out recently in the last little while from the Ontario Public Health Association. It's currently in its second phase. And this second phase does have an explicit focus on equity. And so it's interesting for us to look at here as a local example. And it's, when I think about what Courtney said, it's one of those many strategies and tactics to make change is to engage in these kinds of public health campaigns. But then, of course, there are so many different audiences for messages about the health equity impacts of changing climate. There's communicating to policymakers and getting ministers to listen, and Courtney spoke a little bit about that. And then there's communicating to the general public and having the general public know why it's important to do these things and to consider climate in the way that they vote, in the way that they organize their lives and their beliefs and their value systems. And also, of course, a third audience, which gets maybe identified less in some of these toolkits that we see, is actually communicating to intersectoral partners so that change-making efforts can be more streamlined and more coherent. So I thought that was all really interesting to think about, that there's these multiple strategies and techniques and tactics.
Thank you, Pema, and that was, thanks, Courtney. I've heard a couple of your presentations, but every time I hear it, I get more motivated to continue doing the work that we're trying to do. And even though we've completed phase 2, or we're continuing phase 2 of our Make It Better campaign, we may have to recruit you as we get on to phase 3, because we do have communications expertise, but certainly your input is so valuable. So I'm going to be speaking about the Ontario Public Health Association's Make It Better campaign. I'll give a little bit of background about phase 1, just to put it in context, and then talk about our results from phase 2. So the Make It Better campaign began in, I think, 2017, 2018, and it came about because there was interest from health and environmental sectors about raising awareness of the urgent need for climate action. And there was grave concern that the general public wasn't making the connection between climate and human health, and the environmental organizations connected with some of the health organizations such as OPHA to see how we could work together. So we had an opportunity to develop a health-focused communication strategy, and that's what led into our Make It Better campaign. And we had lots of partners and funding from the Atmospheric Fund to start, and with other funders as the campaign progressed. And so the whole purpose of the campaign was to reach audiences that were interested in health messages, but currently they weren't speaking about climate change. So I'll just speed it up a little bit, about the background of the Make It Better campaign, how we came together with health and environmental partners to increase awareness of the need for urgent climate action. And then, but we also looked at where is the need, and is there a need in the general public? Is there a need for the public health community to also have some tools to help their sectors raise awareness? So obviously we know the evidence of climate-related health risks is very real in Canada. And there was a 2017 climate opinion research survey that was done, and in that survey, half of the respondents felt that climate change would cause harm to them personally, either not at all or only a little. So that was quite disturbing. And in addition, 23% of the respondents who believed that climate change would harm them a great deal did not speak English or French. Also, the Ontario Public Health Association did a survey of health units across Ontario, and while we found that health units said they were communicating about climate risks, focusing on one or more climate-sensitive health risks and using a health equity lens as they look at addressing those risks. A 2019 survey done by the Survey Research Centre in 2019 of public health agencies across Canada identified that only 50% of them had engaged in climate change and health education and outreach for the public, to the public. So we felt that our campaign, a health-focused climate communication campaign, was certainly timely and would be of benefit to our partners and as well as the general public. So when we were developing our campaign message, we made sure when we were screening them that the language we were using wouldn't amplify inequities or assign guilt or stigma to any segment of the population. So if we're providing messages, it's not something where people feel they can't do anything about it. So we wanted to make sure that we were providing a message about the health impact, how you could protect yourself, and what action you could take to get more involved in climate action. We also wanted to connect with an issue that was of most concern, which was protecting children's health. So that's why we focused on that audience. And we did test our target message to a certain degree with diverse demographic, income, education levels, and political ideologies. And this is just an example of one of our campaign messages. So our communications consultants and our public relations and helped develop this audience journey, which was going from generating interest to inspiring the audience to question the information provided, to then making the link to climate change and motivating them to take action. So this example on this screen is the Lyme disease example. So talking about the number of cases of Lyme disease, how children are more vulnerable, how climate change is partly responsible for the spread of Lyme disease, other things as well, and how we expect, because of climate change, we're going to get spread of the tick. And then the final action be protect your kids, protect our future, which had some messages about how they could protect their children. So as we were developing that first phase, we tried to promote the health equity benefits that could be achieved through climate action, whether it was transportation, food, urban planning, or energy systems. And we also promoted things that were happening in the community, like kitchen table climate conversations. And we encouraged those that were taking part to be involved in individual activism, using words like engage in climate conversations in your community, start your own neighborhood climate action group, or become a change maker in your community. So for our phase one, we had 3 climate-related health themes with one tagline. So the health themes were Lyme disease, asthma, illness, and heat-related illness. And the tagline was, make it better, help protect children from the health impacts of climate change. And for the first phase, this was one of our social media messages. And this was, I had showed you in that audience journey. So the campaign, phase one, launched in 2019 to great success. We had certainly a lot of traditional media. Our executive director, Peggy Walsh, was interviewed in the first few weeks by national news media, and we got lots of multicultural media that reached over 1 million. The news stories in English and French reached over 10 million, so we were quite pleased with that, with the media coverage we got, and also the social media coverage. But the lessons we learned from that first phase, that the importance of multi-sectoral collaboration, because we couldn't have done this without the partners that we had, and the public health, healthcare, environmental, and other agencies that were helping us craft the message. We made sure that the message was evidence-based, so it was reviewed by the agencies, the government agencies that would have been responsible for collecting the data, whether it was Public Health Ontario, Public Health Agency of Canada, or Health Canada. And that broad media reach certainly was a success, but we recognized some of the limitations from that first phase, is that throughout the campaign, while we tested our messages, we didn't necessarily include the range of perspectives within the campaign development. So that would have been helpful if we were able to do that. Because of budgets, we weren't able to translate into several languages. And also the evaluation, we were able to look at social media uptake, but not really be able to identify whether or not the campaign was effective in terms of changing behavior or garnering support for climate action policies. Another thing we identified is that there was limited data on climate-related health risks. We knew the risk, but to actually identify, well, how many heat-related illnesses are occurring in Ontario, how many asthma hospitalizations related to that air pollution that was on a day that was also on an extreme heat day. So the way data was collected made it a little bit challenging. And we knew more work was needed to ensure health inequities were addressed. So we launched phase 2 in 2020. We brought back the same partners and additional partners. And the aim and the strategic imperatives for phase 2 were to increase awareness of the connection between climate, health, and equity for children, as an urgent and escalating issue. And we wanted to engage a diverse community within the conversation about anti-racism and equity. We leveraged the voices of the health experts. We used community stories, something that Courtney talked about, the importance of stories, and we combined those stories with the facts to shed light on the very real climate-related health risks for marginalized and racialized populations, including children. But very importantly, we wanted to make sure that we talked about solutions, because we needed to show that communities had solutions. We wanted to use the term active hope to show that if we can help communities leverage the community agencies that are already working on things like equity, we can do a lot and to help solve some of the climate issues and health equity issues. This is a big, long list of all of our partners. The Ontario Public Health Association, we had staff and we had our work groups, and we had our anti-racism task group that also looked at our messages. The Canadian Institute of Public Health Inspectors, that's my profession. They recently started an anti-Indigenous and anti-Black racism campaign, so they joined our Make It Better campaign. The Urban Alliance for Race Relations, the Centre for Environmental Health Equity, the Canadian Partnership for Children's Health and Environment, and a number of other health and environmental organizations. So we had two target audiences for our social media campaign. It was those that were new to political action and that were stirred by issues of systemic racism and the increasing demands for health equity and social justice. And we wanted them to believe that the conversations were urgent ones to have, and that those conversations would help drive action in their community. And we wanted them to be able to go to the Make It Better website, either to get information themselves, read the stories, or put their information that they wanted to share. And our tagline, be part of the action. Our secondary audience for engagement and outreach were going to be our partners and our allies. So people who self-identify as racialized, marginalized, living in racialized communities, and the leaders and activists who are already engaged, or sorry, not already engaged, but also public health and healthcare workers, as well as community groups who serve racialized or marginalized communities, and those that are working on local climate health vulnerability assessments, because it's a requirement in Ontario for health units to do that, and also to include a health equity lens when they're doing those assessments. And we wanted them to realize that they play a critical role in calling for action on climate change and to see themselves as partners, and that certainly worked out quite successfully. So our Make It Better campaign, we had a call to action, and we had key messages, key facts, and stories. And our tagline, be part of the action, was learn more, take action, join us, and connect with others. Our core message was no child should have to suffer the health impacts of climate change and the inequities that put them at even greater risk while solutions exist. So for every message we had, we talked about the inequity, we made the connection to a climate-related risk and children's health. And in context, connecting the inequities, our main line was, as public health experts, we know that kids are at higher health risk because of climate change. We also know the risk is not equal across and within communities, that many children in Canada live with inequities that are making them more vulnerable. And then for each of these, we provided a couple of facts. So for example, and I have references at the end of this presentation where we got the information from. So children from the lowest income neighborhoods in Canada are hospitalized for asthma 1.5 times more than those from the highest income neighborhoods, and the proportion of children living in low income families in Canada is higher among racialized and Indigenous children. This was the challenge. So we wanted to talk about the challenge that we needed action for. So from asthma, heat-related illness, anxiety or depression, children are amongst the most at risk, and climate change can worsen inequity. So we continue to re-emphasize that message. And as public health professionals, we're increasingly concerned about the risks. And we also added in the point about the need for more data. So just as we need more data about the health outcomes related to climate risks, we needed more data about inequity so that we could better communicate the risk and raise the awareness for urgent action to protect children, and especially those that are most at risk. and the opportunity. So this is where we wanted to speak about community-led solutions. And this was a really exciting part of the campaign because I had an opportunity to connect with a few different groups. And the first one was the picture there. It was a storybook that was written by an Algonquin elder, Albert Dumont, from just near Ottawa. And he worked with the Ottawa Public Health Department to write a storybook about a relationship he had with his grandson and about protecting yourself from vector-borne diseases. So he saw this writing the storybook as an act of reconciliation with the health department and the community. So it was an excellent example of positive climate action. Depave Paradise was another one where schools are working to naturalize the schoolyard, and it's a community-based, and it's a climate solution, but it also has equity benefits. And the third one, Generation Green, was from Halton region, the Halton Multicultural Council, and it was about engaging newcomer youth on climate action. So there's lots of information on our website, but these were just examples, and other examples about community gardens, affordable housing, and how that is being linked to climate action, mitigation, and adaptation. So our call to action was that every child should have the protection they need and have equal access to healthy environments. And linked to our campaign, Together We Can Make It Better. So we had quite impressive social media campaign results. These numbers don't mean anything to me, but according to the industry experts, these were quite impressive. The information that got the most interest from those that looked at the website was the Lyme disease message, followed by heat-related illness and asthma. But these were also all linked to health equity impacts. And this was one of the images that received the most attention. This was our message: climate change will affect everyone. Those already experiencing inequities will disproportionately be impacted, and then linking it to climate change. And this was the other one. So we looked at how we could integrate messages about COVID, whether it's about COVID and respiratory infections, or persons that are living in areas with poor air quality being more at risk from COVID and other respiratory infections. And we talked about how with climate change we can expect more epidemics of disease endemic to Canada and possibly new diseases. So this was the other image. We had about a dozen or more images, and this was the second one that got the most attention. And this is just another example. I have a few here. I think once you get the slides, you'll be able to go through these or go to our website as well. Another one about low-income neighborhoods more likely situated in climate risk areas. And we talk about how if we work for climate and equity and focusing where the need is greatest, we can make it better. So some of the successes of that campaign, we had an opportunity to collaborate on climate change and health equity, and we realize that is so important and key to making progress. We're continuing to do that. It's building slowly, but obviously in the time of COVID, there's so many other public health priorities, but we still continue to have connections with our public health partners and others. And we were able to establish new relationships and work on a few additional projects, and we're excited about being able to do that. But we also saw this as an opportunity for our partners to leverage our messaging. So as public health units are grappling with COVID, they're still working on their climate and health vulnerability assessments, and we see this as a way to be able to use our evidence-based messages and our communications specialists that we're able to frame the messages and the stories in a positive, evidence-informed way. Some of the challenges, obviously, during the pandemic, getting media coverage that was, other than social media, the only other media coverage, I got local media coverage, but that's because I had a local connection with our local newspaper because of an interview I had a few months before on climate change and health. Challenge as well in evaluating the success beyond social media interest. So did we have a change? Was there more awareness on climate and health linkages or behavior change? Is there more support now for climate action because of our campaign? We haven't been able to evaluate that, and that's going to take more resources, but we are looking for more resources to do that, because this campaign, it was the volunteer work of a lot of our partners and staff at OPHA and the volunteers in our work groups. And finally, our next steps, continue to explore opportunities with partners and funders. We continue to update our website. We just put out a Make It Better newsletter. We're doing that on a regular basis. And continue to promote through things like our webinar today, how we can promote the campaign, but also how we could evaluate just to identify the success or show the success of the campaign. So I have to thank our many partners and advisors and our funders. And that's it, just the references, and that's it.